Horripilation, better known as goosebumps, the temporary local change in the skin when it becomes rougher due to erection of little muscles, as from cold, fear, or excitement. The chain of events leading to this skin change starts with a stimulus such as cold or fear. That stimulus causes a nerve discharge from the sympathetic nervous system, a portion of the autonomic involuntary nervous system. The nerve discharge causes contraction of little muscles called the erectors pili hair erector muscles. Contraction of these muscles elevates the hair follicles above the rest of the skin, and it is these tiny elevations we perceive as goosebumps. The words used to describe this condition are very curious and quite colorful. Goosebumps are also referred to as gooseflesh. A fancier term for this familiar phenomenon is horripilation. Horripilation was compounded from the Latin horrere to stand on end plus pilus hair equals hair standing on end. If you think horripilation sounds horrible, you're right. The word horrible also came from the Latin horrere and referred to something that was so awfully dreadfully frightful that it made your hair stand on end. Medicine does not use a horrible term such as horripilation and rarely resorts to the commonplace words, goosebumps or gooseflesh. Medicine has a special term, cutis anserina, for goosebumps. But it goes back to the goose again, since cutis skin plus anser goose equals goose skin. Some biologists believe that goosebumps evolved as part of the fight-or-flight reaction along with heart rate increases that send the heart racing while blood rushes to the muscles to give them additional oxygen. A similar phenomenon, bristling, in fur-covered animals may have made them look larger and more frightening and kept them warmer by increasing the amount of air between hairs which traps body heat. But in people there seems to be no practical purpose for goosebumps except, of course, to make our skin crawl.